Hi, this is the third webinar in the series on using symptomquiz.com and starting a functional medicine practice. I'm Dr. Paul Varnes. I'm happy to help you with anything you need. There's my contact information. So just a quick review. You can address insulin insensitivity. Probably most of your patients will have that if they're carrying a little extra weight. Simply give them enough magnesium, some CGF, which is a multiple addressing insulin insensitivity, and then the roadmap to health diet. A lot of things will improve. Not just blood sugar handling, but things like PMS, headaches, ADHD. Just the list is very large. You'll be surprised at how many of our problems are caused by insulin. Insulin is very inflammatory. The other thing you want to look at is intestinal permeability. We talked about the microbiome. And I should probably mention to you that probiotics help the immune system. There's a new thing you can search called spore-forming probiotics. They actually help to heal leaky gut. And leaky gut is a huge source of inflammation. This is something that you could routinely give to patients and go a long way in reducing their inflammation, helping to heal leaky gut. It's a good adjunct to people with autoimmune disease. It's a good adjunct to people with allergies or general immune problems. It's very good to do. And then the other thing we talked about last time, of course, is treating the digestion from north to south. If a patient isn't digesting well, then you want to make sure they have enough hydrochloric acid, pancreatic enzymes. You want to keep food from rotting in the intestine. One of the reasons the roadmap to health is set up the way it is so that food can support the microbiome in a positive way. And this is something that's easy enough to promote in your waiting room. I've got these posters for you. I can customize it. Just start with a simple wellness plan. You don't need to be saying, oh, I'll treat this or that. In fact, it kind of works against you to tell them that you're treating specific disease. Just do a 30-day wellness program, change their diet, do some basic supplementations, and you'll be amazed at how many chronically ill people improve. So the categories we're going to cover today are vitamin, mineral, and fatty acid need, gallbladder, we'll talk specifically about biliary stasis, patients that need immune support, and insulin insensitivity we're basically going to just mention because we went into that into great detail, but it will show up on the symptom quiz, so it's worth mentioning again. And symptomquiz.com will give a total health score. It's like a golf score. You can have the patient follow a program for 30 days and then retake it, and they can see how their score has changed. You can also, they've got a booklet that you can follow and pick one of the categories that they score high in, major or significant, and have them follow the nutrient recommendations for that on top of the dietary changes, and you'll change people's lives. You can go 30 days at a time and just little by little improve people, and just call it a wellness program. Not necessarily I'm treating. You don't really treat headaches. You don't really treat digestive complaints. You're fixing infrastructure. It's a chiropractic cliche: the power that made the body can heal the body. This is a free PDF. It's a guide to using Symptom Quiz. It'll give you strategies if you do have someone with a major category that you want to treat. It'll give you a bit of a background, and you can get into more detail with how you treat. And also the roadmap to health. The roadmap to health is designed to balance the microbiome. It's hypoallergenic. It helps with digestion. It's got a low glycemic load, and it's nutrient dense. A lot of your patients' health problems are caused by choice, by the choices that they make. And I've had docs talk to me and say, oh, I've got someone with PMS, what can I do? If you start with the diet, the PMS, and if you're a chiropractor, you're adjusting them, that will automatically take care of it. A lot of people want to do like a protocol, and it's like, okay, give you some magnesium, some B vitamins, some liver support, and so on. And those kinds of protocols are available from Balancing the Body Chemistry, and they're useful mostly for people that don't listen to you. And I usually make a point of explaining to people, well, if you're not going to do the diet, I can give you more supplements, I can do other things, but you might not get as good of a result because the diet fixes a lot of sins, and except for your very, very ill people, you'll get really, really nice results. It addresses the microbiome, and if you add a spore-producing probiotic, look that up, to that, you've done a lot to improve digestion, and then just basic nutrient support. People will get better day to day, week to week. It'll be very surprising to you. So one of the categories that they can get a high score in is in mineral, fatty acid need. And you need to consider dietary habits. I mean, people that eat a lot of crap will score high in this. Just give them, CGF, essential fatty. You can just dose them with nutrients. Toxic exposure a lot of times will cause a vitamin need. Watch for prescription drugs. There's a great book out called Drug Muggers that tells you what the various prescription drugs are depleting from your patient. And if you look at a lot of low-grade problems are caused by minor nutrient deficiencies. And then you throw on top of that a drug, and generally, when you're managing people with prescription medication, you're slowly making them worse. Medicine seems to work best in emergencies. And then, of course, alcohol. Recovering alcoholics usually need lots and lots of nutrients. So there's more material in the PDF that I have available to you. We're just going to talk, about a few different vitamins, things that might show up. One that patients will tell you they've got Chinese restaurant syndrome. They have to absolutely make sure there's no MSG. That is for sure a need for B6. So if you have a patient, a lot of times they'll have anemia and they're taking iron and it's not doing them any good, and it's a normocytic anemia. A lot of times that's a B6 anemia. Women with PMS. B6 can play a role in depression and anxiety because it's a cofactor for serotonin production. Depression in celiac patients will show up. A lot of docs will give B6 for carpal tunnel. I haven't used it that way. What I find a lot of times, what we call carpal tunnel, which is supposed to be a collapsing of the carpal arch, is actually kind of a compartment syndrome. Someone's typing on a keyboard and everything swells a little bit. And I've actually used like a B6, B12 folate supplement, and then do fascial stripping along their forearms, and that usually cures that. That's not a true carpal tunnel. That's not a collapsing of the arch, but that's usually the person that's on the computer a lot and their hands go numb. A lot of times that's what's going on with them. People who with allergies and their eyes itch for sure need vitamin A. Drying and itchy of the eye is one of the early signs of vitamin A deficiency. I usually give 25,000 IUs a week or a day for a week. And the other thing to know is that vitamin A stores drop with infection and exposure to chemicals. So you get somebody that's sick a lot, they probably need vitamin A. Vitamin A is very important for protecting the membranes. People that are sensitive to smoke and perfume, molybdenum is a cofactor for converting aldehydes, ketones, and sulfites. You remember people used to say, "Oh, I can't eat at the salad bar because of the sulfites." That's often a problem. A lot of times they have issues with yeast. They've done a lot of antibiotics. You could give them a mild antifungal. The other thing with the molybdenum need that I found is if they need molybdenum, they probably need other trace minerals like selenium and lithium and things like that. And a couple of companies make a good trace mineral supplement. Give them that with a little extra molybdenum, and you'll be surprised. A lot of problems with chemicals and things will improve. Older people who get forgetful, you produce less B12 as you get, or you absorb B12 less as you get older because you produce less hydrochloric acid. On a blood chemistry, you'll see an MCH above 31.9 and MCV above 90, 89.9. The cells start getting big. Macrocytic anemia is at 100, but your blood cells should be much smaller, and usually if you see a large MCV, that's often someone who needs B12, possibly folate. And I've had patients. I have one guy was was going to go to get electroshock therapy. I didn't even know they still did that, because nothing he did for his depression helped, and he had an MCV in the upper 90s, and gave him B12. I used to want to give shots, but if you give a high dose orally, 2, 3, 4, 5, 6 milligrams a day, they'll absorb enough of it that it'll actually do some good. Lithium, nutrient lithium, like lithium orotate, not the drug that they give, a lot of times makes you utilize B12. So if you got an older person who's depressed or forgetful or that, a combination of B12 and lithium orotate will help very nicely. People are deficient in zinc often have immune system issues, skin problems, problems with taste and smell. In fact, I talked to one psychiatrist who was interested in getting zinc into people who are anorexic. He felt that anorexia may have a strong zinc deficiency component. If you're looking at a blood chemistry, alkaline phosphatase below the midline, there's different ranges depending on how they test and all that, but you want it more than half. If it gets much below the midline, that's a for sure sign of a zinc need. They get drunk easily. The cheap drunk, alcohol dehydrogenase is zinc dependent. And also zinc is necessary to produce thyroid hormone. You might check it in people with thyroid issues. Magnesium, cramping, breast tenderness during women's period. Magnesium is nature's muscle relaxer, so if they've got tight muscles, a lot of times twitches that come out of nowhere is a sign of that. It will also, magnesium deficiency can lead to high blood pressure, depression, migraine, headaches, irregular heartbeat, and of course osteoporosis. I muscle test. You can find out if that's an issue. Iodine deficiency. If you get a chance, read Brownstein's book on iodine. He has some interesting observations and says as a society we're massively iodine deficient, partially because we put bromine in our food. All our baked goods have bromine in it, which displaces iodine. A lot of those citrusy looking sports drinks, they'll have brominated vegetable oil. Stuff's toxic. And you'll if somebody's using that or they eat a lot of baked goods, you might find that if you give them some iodine, it helps. Especially women with cysts in their breasts or cysts in their ovaries. A lot of ADHD is a iodine deficiency. It's definitely worth checking into. Last time we talked about a lab that will test that, give an iodine challenge. Thiamine deficiency is very common, especially in your junk food junkies. People that eat a lot of processed foods, and of course they'll need the other B vitamins as well. You'll see an increased anion gap on a blood chemistry greater than 12. A lot of times they have a tendency toward low blood pressure. Increased sense of taste, smell, and hearing. These are people that noises and things bother them a lot, or strong tastes will bother them. They kind of like a heightened sensitivity to things. A lot of times they'll have an unwarranted feeling of impending doom. It's common to see hypochlorhydria in there. You need thiamine to make hydrochloric acid. And also they'll tend to be hypoglycemic. I mentioned lithium in here because it's just a really cool nutrient. I'll try to send out, I've got a newsletter on the research between lithium. We're not talking about the lithium carbonate high dose that they give to people with mood disorders. We're talking about small amounts. They found that if there's a lot of lithium in the water supply, there's less violence in the area, there's less substance abuse. There's a lot of research that shows that it protects the nervous system from degeneration. So you got, if you got Alzheimer's or any kind of neurodegenerative disease in the family, giving them a little lithium is a good idea. It's also very, very good. I've used it straight up for people that were depressed, and in combination with a spore-forming probiotic. Leaky gut and the microbiome and mood are really tightly related. So a combination of lithium orotate and spore-producing probiotic might do a lot for your depressed patients. If they got other digestive issues, you get, give them a good dose of B12 as well. It's a good little shotgun treatment, and you can say to the patient, here, try this and see if you feel better. And a lot of times they do. Irregular cells on a pap smear often shows a need for folate. People on statins need CoQ10, always, 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 always. In fact, my wife's a physical therapist, and she swears a lot of muscle aches and pains are because they're taking statins, and that might be true to that. You got your chiropractor not holding the adjustment there on a statin. Give them some CoQ10. They usually need fat-soluble vitamins, and actually, there's a number of other nutrients that are involved. Get the Drug Mongers book. That's a handy little resource. Yeah, there it is. Drug Mongers, Susie Cohen, RPH. Cardiac meds. Almost anybody taking cardiac meds needs thiamine and magnesium. Acid blocking meds, minerals, essential amino acids, and B12. Birth control, most of the B vitamins. Someone who's been on birth control pills, give them B vitamins, C, magnesium, and zinc. The other category we're going to cover today is gallbladder. Mostly the questions are about biliary stasis. Your liver should produce a quart and a half of bile each day, and sometimes the bile gets sluggish, it thickens. It'll happen to people with fatty liver. And it can eventually lead to gallstones. The bile can back up. It can actually do liver damage. It can be caused by environmental toxins, chemical additives in the food, poor eating habits, especially sugar. This is a big component of insulin insensitivity. So if you've got someone who eats a lot of sugar and they're starting to get dry skin, their heels are cracking and things like that, they probably need some gallbladder support. A lot of times you'll see high cholesterol. And you'll see it, like I said, in pre-diabetes. And these people will complain about itching. That itching is probably the first symptom, and eventually they'll get cracked, peeling heels. The skin can get really, really bad after a while. Greasy foods will upset them. You can ask them, if I eat a big plate of French fries, does it upset your stomach? They'll say, oh, I don't eat like that. And I says, yeah, but if you did, would it bother you? They'll see clay-colored or fatty stools. Another thing that the biliary stasis you'll see, doing everything that you can for reflux, and it just doesn't seem to respond. I remember I had one lady worked at Burger King like overtime and ate all her meals there, and she was on 3 different reflux medications and nothing was working. And I poked her under her rib, Murphy's sign, and she went yow. She had a bag full of gallstones. So you want to take a look at that. The other thing that biliary stasis will do, a lot of times you're doing everything right, get enough water, enough fiber, check for food allergies and whatnot, and the patient is still constipated, you might look into biliary stasis, okay? And of course they'll be deficient in essential fatty acids and fat-soluble vitamins, vitamin A, E, D, and K. One thing you can give to improve digestions of fats, thinning the bile, and helping to address this issue is artichoke extract. It's in a product called GB Complete, which is designed. It's got other nutrients and antioxidants in it, and it's designed to thin the bile and improve fat digestion. A lot of times, if you give a pancreatic enzyme along with that for these patients, that's simple. You change the diet, of course, and they'll get better. And of course, insulin insensitivity has its own score, and we went into great detail on the first webinar. Basically, you give them roadmap to health. You give them magnesium last thing at night because magnesium binds to fat, so you want an empty stomach. And the bowel tolerance, you gradually increase it until they get soft stools. CGF is a multiple designed for insulin insensitivity. Give them a couple of those 3 times a day. And then look into whether they have biliary stasis, because a lot of times the two go together. The next category covered is the immune system. People with immune problems, either they have multiple infections or they get sick a lot, these sorts of things. The one thing that you can give them is spore-producing probiotics. It helps heal leaky gut. 75% of your immune system is in your gut, and it's a really good start. And then you can add to that other sorts of things depending on what's going on. I'll do muscle testing. I like arabinogalactan. A couple companies make that. Arabinogalactan is a 60,000 Dalton carbohydrate that's involved with cell recognition, and it's the active ingredient in stuff like Echinacea and astragalus and Dr. Diadamo, the guy who did the food type diet, found that he could get huge amounts of what he was paying a fortune for in echinacea as a powder. And a few companies make this. Most of my patients will have it for cold and flu season. I swear to God, if you feel like you're coming down with something, you take a teaspoon an hour of arabinogalactan. It just knocks it out. It's great stuff. Vitamin A. Vitamin A is important for membranes. People that get a lot of bladder infections, sinus infections, things like that. A lot of times they need vitamin A. Now you have to be careful because if you give them too much, it can be toxic. Um, but the good news is, or well, bad news, if they get a lot of infections, they deplete their stores of vitamin A, so they tend to be very deficient anyway. So you can probably give a pretty good amount. Like do it for spurts of time. I'll do 25,000 IU's. Go for maybe a week and then back off of it. If someone's just getting sick, I'll give them a higher dose for a day or two, and that helps. Vitamin D status. Actually, with COVID, they found that if you have adequate vitamin D, you won't get a bad case of COVID. Vitamin D is very much involved with protecting you from inflammatory cytokines and things like that. Vitamin C, of course. I believe that like IV vitamin C for something like say zoster could probably knock. I remember during the AIDS crisis, a lot of the patients before they had the good drugs would go and get vitamin C IV, and it was miraculous. I remember one guy, he was 90 pounds covered in sores. He gained 20 pounds and the sores went away. It wasn't a cure. He eventually did succumb to the disease, but boy, whenever he went and got his vitamin C treatment, he did really, really well. Zorix makes a product called Sinuspray. Chronic sinus infections are a problem. Now, a lot of times these people have taken a lot of antibiotics. Well, once again, the spore-producing probiotics, like you want to balance the gut and heal the leaky gut from all the antibiotic use. That's a good product to take. But Sinuspray is an antimicrobial spray that helps break up the blockages in the ostia and the sinus so that they can properly drain, and it also helps keep bacteria in check. Interesting thing about antibiotics, the Danes did studies and found that antihistamines worked as well or better. A lot of what's called a sinus infection often isn't a sinus infection, and that's worth noting, especially if the person's had multiple bouts of antibiotics. You then, of course, do have to kind of treat yeast. You can take the probiotic and, a mild antifungal like undecanoic acid or oregano oil or something like that to keep the yeast in check. And you reduce carbohydrate in a patient like that. So these multiple antibiotic people, you start working on their gut. And there's more elegant treatments than what I'm saying. I'm just trying to give you some information to get you started, and you can start looking into other things. I obviously won't do exactly what I do. You find your own way. A number of companies make glandulars for the immune system, and there's some science behind that, especially thymus glandular. They found that radioactive isotopes end up in the glands that They're supposed to, and there's other research to support this as well. Here's a couple of other studies that show that glandular extracts target those organs. And thymus is a common one to use. It shrinks when you get older. And also, thymus has been found to be useful for people with food allergies. If they got immune system problems and they're allergic to a lot of foods, you give them something for their leaky gut, you give them a thymus-based product. Yeah, thymus extracts have been shown to support cellular immunity, beneficial to patients with immunodeficiency, and have been shown to increase the activity of T cells and B cells. Immune Plus from Zorex is based in thymus glandula. It's got other immune supporting things and anti-inflammatory things because, as we found with COVID, runaway inflammation is often worse than the infection itself. There's the references. I have this in a handout if you want it. Vitamin A is a common deficiency, especially people with get recurring infections. They'll have dry skin, night blindness, dry eyes, and frequent infections, poor growth in children, and poor wound healing, acne. Of course, if they get toxic, it causes nausea, vomiting, irritability, drowsiness, increased intracranial pressure. Interestingly enough, dry skin also, and weakness. So you want to be careful when you're dosing vitamin A. Do it in short spurts. I'll give a good amount if someone's fighting an infection at that time, but you never put anybody on vitamin A and leave it. All right, I'll wrap this up. I do have paper wellness quizzes. They're a little different. I've got a booklet that goes with it if you don't want people going to symptomquiz.com. And this handout goes with it. And I have to stress, it's peeling an onion. It's infrastructure. The more that you can get your patient to do in the way of compliance, the easier this gets because a lot of this is self-inflicted with diet. If they're not compliant, get some protocol manuals. Tell them you're taking a lot of supplements. I've actually had people get religion halfway through. I remember one fellow had several hundred triglycerides and took all the pills, and we actually brought his triglycerides down. And later on, he started following the diet, and things got much easier. Nutritional consultation is a negotiation. If you need any help, feel free to contact me. I've got printed material on drvarnes.com if you want to use it, if you want me to customize it for you. If you order from Zorex, use code PV10. You'll get free shipping on your first order. And thank you for taking time with this.